Hello, my name is Neat Physio and I'm a physio who specialises in cancer, and this video is for breast cancer patients who are 8 to 10 weeks after surgery, and it is based on safe exercises that are suitable for most patients. These exercises are going to be done in real time, which means you can follow along, save the video and watch it every single day for the 2-week period, or alternatively pick a couple of exercises and do them several times a day. When it comes to doing exercises after surgery, little and often is key. So actually the more you can do it in the day, 2, 3, 4 times, the better, as long as we're not pushing into pain. But first, a quick disclaimer. Everyone has their own medical history, social history, cancer treatment, and physical abilities or limitations. So it's really important to check with a medical specialist to make sure that this or any exercises are suitable for you. And again, we do not want to push into pain. When we push into pain, we're often causing new inflammation, and that can actually delay healing. At 8 to 10 weeks, it's really important to start to push ourselves. So the exercises in this video should only take 10 to 15 minutes, but today we're going to be working on a little bit of mobility, so the range, stability, so the muscles protecting the joint, and then strength, so actually adding in a little bit of load to complete tasks, as well as a little bit of postural correction, because often the shoulders drop forwards and that can cause long-term issues. As a bonus, we are also going to cover at the end of the video how to self-massage your scar and signs and symptoms to watch out for lymphedema, because the earlier we catch it, the quicker we can treat it, and now new research shows it can actually be preventable if we catch it early. The video will be split into sections, section 1 being the main bulk exercises. Section 2, I'm going to do a little bonus section which are bed exercises, and this is really for individuals who are struggling with pain a lot. If you've got a lot of pain, it's far better to just take it down a notch, and by lying in bed, you're actually taking gravity out of the equation, because gravity is actually quite a lot of impact on the shoulder and makes it more painful. I would just do the bed exercises if you're struggling with pain, so just skip to that section. And then finally, the final 2 sections will be on that scar massage and signs and symptoms for lymphedema. The final thing I will say before we jump into the video though, is it's really normal to be struggling with stiffness, pain, signs of cording and fatigue at this point in time. We have essentially moved from the inflammatory phase of healing to now the remodeling and rebuilding stage. And our tissues all are made up of different cell structures, and these cells have different life cycles. What that means is we don't heal linear, we actually heal a little bit wonky, like climbing a mountain. So for example, our skin heals a bit quicker than our deeper tissue. So often during this phase is when we get a lot of discomfort, a lot of tightness, often some nerve symptoms such as shooting or stabbing. That is often actually rebuilding new tissue, so new tissue growth. It's a bit like having a scab. When it gets itchy is actually when new tissue is being laid down and it starts to kind of get a new blood supply and nerve supply to it. And that's very much the same that happens after breast cancer surgery. So it is normal, hence why we don't push into pain. We're allowing these tissues to rebuild by just going slow and steady. Welcome to section 1. This is the bulk of the exercises, and really it should only take you 10 to 15 minutes at a push. Each exercise we're only going to do about 5 repetitions. The reason being is I want you to do it a few times a day. So we're just pushing and activating but not irritating into any movement. For this video, all you're going to need is some kind of resistance band. If you don't have a band, I would use a towel or a jumper that has a bit of give, or at a push, a light weight of some kind, and it could be a can of beans. However, I would prefer you to get a band, purely because when we use a free weight, we don't get the same sensory feedback. So often we can use our more dominant muscles, and that might cause any further postural insufficiencies or biases, such as overworking our chest. So preferably get a band. And we're going to start off with actually just waking up our lymphatic system, which enables healing and helps shunt lymph fluid and kind of the debris from surgery away from the area to encourage good quality healing. So we're going to warm up by doing a little bit of deep breaths with some gentle movements. So to start off with, we're just going to do some gentle shoulder rolls, 5 back and 5 forwards. But whilst you do so, deep breath in and exhale through your mouth. 2, 3, 4, 5, and back the other way. 1, 2, 3, 4, and 5. Next, we're just going to activate and wake up our neck. So the same thing, deep breath in, exhale, turn to one side, back to the middle, deep breath in, exhale, back to the middle, deep breath in, exhale, deep breath in, exhale. And then finally, we're just going to do the same, taking our head side to side. So deep breath in, exhale, ear to one shoulder, back to the middle, deep breath in, ear to the other shoulder. 2 more times, deep breath in, exhale, last time, and exhale. And then the final thing, just to get things moving, is just chest openers. So starting with your hands by your shoulders, we're just going to do 5, opening our elbows back and back in. If this feels quite easy, slowly taking your hands up behind the head. But if that is painful, just keeping it down by your side. 1 more time. And there you go. So we've just woken up the muscles to the shoulder and the neck before we do the main exercises. So most of the exercises are going to be against a wall. So starting off facing the wall, we're going to do what we call a wall walk into flexion hold. So in the weeks of 4 to 8, we were doing just walking our fingers up and down. So we're just going to take our hands up to a point of pulling but not pain. And we're just going to take our feet back and just gently lean into it, into tightness or discomfort, but without wincing pain, and back up. 5 of these, and your end goal is to slowly get further into it, all the way into a deep stretch, but start off really gentle. 1 more, and back up. The next exercise is working on rotation. So all we're going to do is keep our fingers against the wall or the palm, whichever you prefer, elbow into your side, and we're just going to do 5, turning ourselves away and back in. 2, nice and easy, stretching out but not into pain. 4, last one. 5. If that does feel quite easy, we can take it up a notch by just trying to take your arm further up the wall, twist yourself away. And the goal point is to have your elbow against the wall level with your shoulder. However, jumping to that straight away will be a bit too mean. So start off down here and just gently take the hands up over the couple of weeks into that deeper stretch. The next exercise is a bit harder, and it's building on that hand behind back. So previously we did arms up in this position. If this is still a challenge, just stick with this movement. So you just do 5, going down and just trying to stretch into it up and down. However, we can take it up a notch with that band or a towel. With the towel or the band, good arm up, try and hold it at the bottom, and then essentially you're going to use your good arm to pull it up as far as you can and back down, and we're just going to do 5. So 2, 3, 4, and 5. Now we get to add the band into our movement. So placing the band on the floor, standing on the band, you're going to take your chest down, so keeping your back flat, and we're going to do what we call a row. So the goal here is pulling the band towards underneath your armpit, and it kind of in between your ribs and your breast. Squeeze and down. But what we're doing here is we're also trying to pinch our shoulder blade back. So pull, squeeze, and relax. We are going to do, again, 5 to 10 today, just to take it up a notch. 4, 3, 2, 1. Last 2 exercises. So we're going to start off with the band out in front of our chest, a bit wider with the band, and all we're going to do is try and draw it back in and back out. So again, we're squeezing our shoulder blades and imagining we've got a pencil case that we're trying to squish. And we again are going to do around about 5 to 10, so a few more repetitions just to really activate those muscles. So almost there, we've got 5 more. 1, 2, 3, 4, last one, 5. Final exercise is taking your hands up against the wall again, about chest height, and we are going to do shoulder blade activation into a wall press, which is harder than it sounds. So if you need your hands a bit lower, not a problem. You are going to push the wall away and round your back, keep your elbows straight. Next, you're going to try and draw and squeeze the bottom corners of your shoulder blade together. Press into the wall, push up, round the back, squeeze the shoulder blades, back in. So 2, we're going to do 5. 3, it's harder than it looks. 4, and 5. Fantastic. That one can be quite tricky, so if you need to, take the press out of it and just focus on rounding the back, squeezing the shoulder blades. Rounding the back, squeezing the shoulder blades. Not a problem at all. Welcome to section 2. These are bed exercises. They are literally going to take you 2 to 3 minutes. They're useful for individuals who are really struggling with pain, so I would only do these exercises because they're just going to take it down a notch and allow things to become less inflamed and painful so that you can then progress onto the other exercises. All you're going to need is something to push with, so I'm going to use a water bottle, but it's just to help make your arm less active. So, lead on your back. If you find lying flat is too much, just elevate yourself a little bit. That's not a problem at all. But we're using the water bottle to make our affected arm a dead weight, so it's passively moving rather than actively moving. So we're going to do shoulder flexion, so taking our arm up overhead, using our other arm. This arm's just going to rest on the bottle, so it's not really involved in the movement. And my other arm's pushing it up as far as I can into a bit of tightness but not pain, and back down, and we're just going to do 5. So 1, 2, and the goal here is to slowly take it up a bit further. 3, almost there, and just into discomfort but not pain. 4, and you should find by the end of a couple of weeks you can take it that bit further. 5, and back down. In this position, it's also not a bad test because our arms should be able to go all the way back and rest on the floor. That is a normal movement for a shoulder unless you have a pre-existing problem. So it's also a useful test to see, have you actually got true range? Because sometimes you'll go, yeah, my range is full, because when you're standing up, you're using other muscles rather than actually, is there a restriction in the movement? The next exercise is taking our arm out to the side. I'm going to show you 2 little variations. So again, using the weight passively, put your arm on the bed, so the roof of your hand is on the bed, and again you're using your other arm to take it out as far as you feel comfortable and back down, and again we're just going to do 5. So 2, and each time a little bit further. 3, and this is the most painful movement for the shoulder to do, so don't be alarmed if it takes longer to see any improvements. 5. Now, if you actually wanted to take that up a notch, we can also, and I would do both arms. I'm trapped by the wall, so I'm only going to do one arm. But what you would want to do, roof of your hand against the bed, deep breath in, exhale, and just slide it up. So now it's not passive, it's just as far as you can. Deep breath in, exhale, lovely. 3, exhale, and back down. 4, exhale, and back down. And last one, Exhale and back down. And then the last exercise we will do in this position is what we did in standing, those chest openers. So if you are struggling with mobility and pain, keep your hands on your shoulders. Elevate your elbows as far forwards as you can without going into pain, and then just squeeze your shoulders back and back in. And again, just doing 5, 2. And if this feels easy, try and take your hand behind your head, and you'll find this a lot harder. 3, 4, and 5. Welcome to section 3, and this is on scar tissue massage. Now, before we begin, always check to make sure your scar has fully healed and there are no signs of infection before you start any type of massage. If you have concerns, get them checked by a nurse just to make sure that it is safe and suitable, but also if you have an infection, that it is going to be treated. Now, scar tissue is a natural process that forms when our body goes through some kind of trauma. And that also includes sports. So say you run a marathon, you get micro tears in your muscles, and that creates some broken blood vessels. So what happens is our body sends collagen fibers, which form as scar tissue because it needs to be laid down really, really quickly. So these tissues are less strong, they're a little bit more haphazard, and often our body over a couple of weeks will then go and try and fix that tissue to make it more stable and secure. So scar tissue is a natural response to any type of trauma. But obviously something like surgery, the trauma is more invasive, hence why you see a scar. But we also do get scar tissue formation from things like radiotherapy as well. So sometimes you might not see the damage, but that damage is there. And scar tissue is also a little bit like an iceberg. For example, I've drawn a line on my forearm to demonstrate a scar, but what you see is not necessarily exactly what's going on underneath. The scar tissue will be deeper and often not linear, so it might not always be straight down. You might notice there's some thickened tissue to the right or the left. That will still be scar tissue formation. Now, we can start massaging a scar the second it is fully healed. So you should massage your scar 2 to 3 times a day, but really only for a couple of minutes maximum. Massage it without any cream at all. And what we're going to do, I'll demonstrate for you today, is we're going to initially start really light and gentle for the next couple of weeks. The reason being is we want to stimulate good blood supply, good oxygen, good nutrients, and we also want to teach any nerves that are damaged what normal sensation is like, because often people have numbness, tingling, burning, shooting, and we want to calm all of that down. So all you're going to do to start off with is what we call brushing. So either using your fingertips or the little bit of your knuckles to your hand, and you're going to just gently, almost like you're tickling the top of your hand, brush over where the scar is, but also the surrounding tissue, which could be the whole breast, can be under the armpit, but very, very light. The second type of massage to do is what we call linear massage. So along the line of where the scar is, again, light-ish pressure, we are just going to be rubbing along the scar. So we're not trying to cause any pain or bruising, we're just trying to encourage good healing. And now you can do this slow and you can do it quick. Doesn't really matter, but again, around about 30 seconds. And then finally, we've got cross fiber, which is going across the way of the incision. And this is to try and help break down some of that thickened bumpiness or any fibrotic tissue. Like sometimes you can feel some little bands to try and help soften that area. So again, tips of your fingers, and we're again being lightish pressure, just pushing across the scar. And as we did with the linear, you can go nice and slow, or you can go a bit fast, and again for about 30 seconds. Once you've done those massages, so morning and night and maybe in the middle of the day, you want to put some kind of cream down that has a high water content. And you would just rub it into the scar and the surrounding tissue once, twice, 3 times a day. Once that moisture has kind of sucked in and it's no longer, visible on the skin, then what you want to do at this stage is apply some kind of silicone, because silicone almost helps protect and encase the scar to try and make it heal as good as possible and limit any more friction to the area. It also helps with nutrient supply. So this could be a silicone gel or a silicone sheet. You just want to check to make sure with all of the creams that you're not allergic or hypersensitive. I would try either the gel or the sheet. Generally, the sheet is more recommended as long as it doesn't peel off. And you can wear the sheet for as long as you can tolerate, because what it does is it kind of adds a bit of compression and traction. So it's naturally trying to enable that scar to stay soft rather than become rigid. Or the gel can work really well if you're finding it's in an area where the sheet doesn't want to stay stuck in that place. Now on to section 4, the final section on signs and symptoms of lymphedema. So lymphedema is a condition that can occur if the lymph nodes have either been damaged or removed from surgery, radiotherapy, and other treatments. And just having lymph node removal doesn't mean you will get lymphedema, but there is an increased risk. Our lymphatic system is part of our immune system, and it's our body's way of getting rid of byproduct of day-to-day life and things like surgery. And obviously, after this kind of surgery, that lymphatic system is going to be working harder because it's trying to shunt all the debris away from the body so that we can heal more effectively. Now, lymphedema is a condition that if you get it, research shows it is irreversible, which means it's something you need to manage. However, new emerging research is now showing that if we catch it very, very early, we can stop it in its tracks, so it could be preventable. So these are the signs to flag to your nurses so that you get that quick, speedy referral to try and get on top of it as soon as possible. The first sign is any feeling of heaviness. That could be heaviness down the whole limb, heaviness to the breast. You might not even see any swelling, but if you're feeling heaviness, let your nurses know. The second sign is swelling, but swelling that doesn't go down within 24 hours. And that could be swelling down one whole area, swelling into the breast, or swelling to a specific spot. Many ladies might notice initially that they're just getting swelling, for example, around the elbow or around the fingers, but not necessarily the whole arm. And that can be an early sign. And also just feeling that tissue. If it feels thick, if it feels less mobile or rigid, again, it's worth speaking to your nurses. And then the final thing to look out for is skin changes. So as I said, the texture might feel thick, it might feel rigid, you might notice kind of dimpling, or when you press your fingers, it takes a while for the tissue to kind of bounce back. Those are easy signs for early lymphedema, and it is worth checking. Now, it doesn't mean it is always lymphedema. It could just be actually the lymph fluid is trying to shunt and it's just a bit slower, or it could be all sorts of different things, but it is worth getting it checked. If you found this video useful, don't forget to like and subscribe, as we are going to do follow-on videos over the next couple of weeks on this topic so that you can advance getting back to hobbies or sports that you enjoy. And let me know in the comments if there's any topics you want me to cover, as I'm really keen to give out the best information I can on topics relevant to physiotherapy and cancer.